ኦልራይት ሰላም ሰላም እንዴት ናችሁ? ሁሉ አለን ሶስት ኢትስ ራንደም አርብ ሳተርዴይ ሰው ጥያቄ ምናምን አብረን እንሰራለን እያነበብን ምናምን ነበር የዋልነው። ያነበብኩት ነገር አክቹዋሊ ገብቶኛል ለማለት ግራ ይገባል። አይ ዶንት ቲንክ ሶ some work. Okay, and እዚህ ጋር የያዝኩት and let me share my screen. All right. Window. So can you see my screen? All right. So I asked DeepSeek to give me USMLE-based questions on white blood cell disorder. All right, and we will do them one by one. All righty. All right. This is actually a post for የሶስት ዓመት ፍቅር የሶስት ዓመት ድካም በ30 ብር ብረት ለመሆኑ ይሁዳ ምን ነክቶት ነው ወይስ የሰው ልጅ የትርፍና ኪሳራ ስሌት ከጥንቱም እንዲሁ ከንቱ ነበር የሚል ነው። እሺ so let's go baby boy. All right, ከመጀመሪያው እንጀምር። Okay, a 68 years old man present to his primary care physician with progressive fatigue and intentional weight loss over 3 months and early satiety. So ቶሎ ይጠግባል, which means ሆዱ አካባቢ something እያደረገው ነው ማለት ነው. So he has no significant past medical history and take no medication. We rule out any kind of medication and vitamin signs are normal on physical examination. Splenomegaly is noted. Okay, this is something marker, but there is no lymphadenopathy. Okay, lymph ላይ ደግሞ ችግር የለም። So lymph ጋር የተገናኘ አይደለም ማለት ነው። Okay, maybe bone marrow. So laboratory studies reveal, right, this is በጣም huge ነው, out of range. WBC count በጣም እንዴ የማይሆን ነው። The hemoglobin is also kind of severe now, so we can know something going on and the peripheral blood smear markedly increased white blood cell with predominant small mature appearing lymphocytes with smudge cell. Okay, smudge cell, we know what a smudge cell is. And flow cytometry, smudge cell of these are the markers this. Okay, it's B cell እንደሆነ ግልጽ ነው. And CDFS negative and monoclonal surface immunoglobulin light chain restriction kappa. So one of the things is normal now, and the hemoglobin is very low and the platelet is low. So what is it? Is it hairy cell leukemia? And because one of the hallmark is smudge cell, biopsy smudge cell, the histology smudge cell የሚያሳየው is, I believe, acute lymphocytic leukemia. Okay, right, I don't think so. I believe chronic lymphocytic, but lymphocytic እንደማይሆን አውቀናል። All right, so lymphocytic አይደለም ብዬ አስባለሁ. And hairy cell leukemia, acute lymphoblastic leukemia. Okay, so old age ነው, so 68 ዓመቱ ከሆነ we most commonly እዚህ ጋር አናየውም። acute lymphoblastic leukemia is mostly the youngsters now. So this one is kind of for the older, so B ይለዋለሁ ማለት ነው። So chronic lymphocytic leukemia, and this is the most common leukemia in older adults and typically present with lymphocytosis, often these mature appearing lymphocytes, fatigue, and splenomegaly, and small cell on peripheral are classical finding due to fragile lymphocyte, and flow cytometry shows okay, weak surface immunoglobulin and weak CD20 classic CLL immuno. And in contrast, mantle cell lymphoma chooses C is typically this. Okay, can I open this man? Okay, so Ziga, this is the new plastic. I hope ይዣለሁ ብዬ አስባለሁ ኖት ካልያዝኩ ደግሞ I believe እዚህ ጋር ኖት የያዝኩት ኦኬ ኖትፓድ ላይ ይዤዋለሁ። እሺ እሺ where is this? Okay, this is ALL. እሺ then okay, so CLL የለም the chronic one. okay በላሽቸዋለሁ ነው። Okay, let me show you my note. በአሪፉ ከገባ ወይ የማይሆን ነው እንትን ያደረገብኝ ማን እዚህ ጋር በአሪፉ ነበር ያስቀመጥኩት። ቆይ ለሚስ ስክሪንሾት ላድርግና ላሳያችሁ። ኦር ስክሪንሾቱን ላሳያችሁ። this is the screenshot. ያው እዚህ ጋር እንደምትረዱት we have እዚህ ጋር or እዚህ ጋር ማድረግ እችላለሁ። all right, okay, so we have leukemia. Leukemia is white blood cell disorder. Okay, can you hear me? All right. Wait a minute, 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 wait a minute. No, no, never. Never. Okay. All right እንዴት ናችሁ? ኦልራይት እዚች ጋር ኦኬ ኔክስት ኖት እንትን እናድርገው ኦልራይት ፕሪቪየስ ዋን ወዝ የተወሰነ ነው እንትን የተደረገው እሺ we are I'm reviewing and review and study then okay we will do yo my guy. So, one of so leukemia we can like በተለያየ መልኩ ክላሲፋይ ማድረግ እንችላለን but the first one is okay is it the time alright so acute or ደግሞ chronic so the acute one is onset is rapid and last in the bone marrow so it's the premature one so but the chronic one is lengthy and also mature one, so it's in the blood marrow. So the other one is myeloid disorder. But if you really want to know the physiology, I hope you have some understanding of what it means to be like the white blood cells have like progenitor cells. They have the progenitor cells. So the first progenitor, so the progenitor cells classified into like myeloid progenitor cells and also lymphoid progenitor cells. All right. So the lymphoid ones, like let me give you the notes. So hematopoiesis. So when we have hematopoiesis is the science, the development of blood cells, not only white blood cell, but the whole blood cells and the bone marrow. So bone marrow line of the meter. So this is the graph. Okay, this one is the graph. So let me show you. So we have multipotent hematopoietic stem cells and it can renew itself as you can see here we go they are directional dermatitis it can renew itself and we have two common myeloid progenitor cell and common lymphoid progenitor cell and for common myeloid progenitor cell we have megakaryocyte which is thrombocytosis and this passes for platelets and the second one is erythrocyte. Erythrocyte, as you can tell, they are RBC, red blood cells, and also mast cells. Alright, mast cells also act as a defense and they live in different cell types. Alright, and the other one is myeloblast. Myeloblast is a progenitor, kind of progenitor, which uh, gives birth to basophil, eosinophil. The basophils have like this kind of shape. The nucleus is not multi-lobed kind of. This is highly granule. Neutrophils are like 3 to 5 lobes, and the eosinophil we have 2 lobes. You can see 2O, O, and the monocytes. Okay, monocytes like macrophages. But when it comes to the common lymphoid progenitor cell, you have natural killer cell, which is large granulocyte and NK. They are very essential. And the others one are list we have small lymphocytes, which are T lymphocytes and B lymphocytes. So lymphocytes are agranulocytes, means they don't have granules, but their nucleus is kind of እንደዚህ ሙልት ያለ ነው. So like this, their nucleus is full የሆነ and like alright. So እንደዚህ ሙልት ያለ ነው. These are agranulocytes. እንደዚህ አይነት shape ነው. This is their nucleus. And yeah, this is monocyte ካያችሁ, this their shape is kind of different. And yeah, both of them don't have granules, as you can see. But here, እዚህ ጋር megakaryocytes አያችሁ በጣም ትልቅ ነው. So chunk እየሆነ ነው the platelets የሚወጡት. So this is it. So we are now talking about the white blood cells. So white blood cells, where can we find the white blood cells? The white blood cells counts. So it's not a red blood cells counts, but the white blood cells, the common WBCs are what you know. These are white blood cells, all right? White blood cell ብለን የምናስባቸው ነገር ነው. These are white blood cells. And also here we have lymphocyte. Lymphocyte is also white blood cell. We have 5 white blood cells. እዚህ ጋር ያሉት ማለት ነው. So now plasma cells are essentially developed from B cells. So when we talk about leukemia, we can also classify it based on time or based on source. All right, so we have myeloid disorder and also lymphoid disorder. So for myeloid disorder, all right, okay, we have myeloid disorder, which means bone marrow, because they're so the myeloid ones, the one here, the myeloid ones, either before they get into the blood, so they are developed into in bone marrow አይደለም. So bone marrow ላይ myeloblasts, they are the myeloblasts. እዚህ ጋር አያችሁ፣ እዚህ ጋር myeloblasts አላልኳችሁም? Okay, this is the immature form before getting to the blood ማለት ነው. So this is acute, it is acute myeloid leukemia. This is the source of origin. Okay, cool. It's acute. It's myeloblast. Okay, what about in the blood? Blood skagaba, all right, myeloproliferative disorder, the proliferation disorder. This can be pilocytemia vera, polycythemia vera, CML, chronic lymphoid myeloid leukemia, or thrombocytosis. All right, we have also chronic myeloid leukemia. This polycythemia vera is like the almost all of the blood types somehow increase, all right, but increase your own. So we will discuss about it later. And lymphoid disorder is also T and B, the B cells. So in the bone marrow, which means you can understand in the bone marrow they are developed as allies, so then they move into different part of our organs to mature. So T cells in the thymus, so in the lymph node as well, and so bone marrow lymphoblasts. So the lymphoblast is the like the bone the okay. Let's see from hematopoiesis of lymphocytes. Okay, hematopoiesis of lymphocytes. Image and we will okay በቀላሉ እንትን እንላለን ማለት ነው. So this is እንድናየው ስለፈለኩ ነው. Alright, this is the hematopoietic of lymphocytes, hematopoietic stem cell of immune cell culture. Alrighty. እስከዛ ድረስ let's go. into our revision. Lymph nodes. All right, under lymph nodes. These are the they are secondary immune system. T cells and B cells. We call them lymphoma. And here we have leukemia and lymphoma, kind of different nature. But okay, so in the lymph node, we call them lymphoma. So plasma cells, multiple myeloma, plasma cell disorder. So the plasma cells as well as it, because here as you can see here, plasma cells are from mature B lymphocytes ስለሆነ so yeah, so we have leukemia and acute. So for acute እዚህ ጋር ሁለት አይተናል አይደለም ቅድም for acute እዚህ ጋር ምን አይተናል? Okay, let's see. በቀይ ላድርገው. So for acute is rush. So acute እዚህ ጋር so ምን አይተናል እዚች ጋር ስለ acute here we have acute myeloid lymphocyte leukemia and also here as well acute lymphoblastic leukemia. So acute lymphoblastic leukemia from lymphoid disorder and acute myeloid leukemia from myeloid disorder. Here we go. Yes, baby. Yes, Bobby. Titanura, titimare, pa 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 pa. Da, da, da. All right. Shoo, 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 mara, na, 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 na. All right. Okay, acute lymphoblastic leukemia. Now, acute lymphoblastic leukemia. Let's go. All right. ጥያቄው እየተሰራ ቢሄድ ይሻላል አይደለም? ኦኬ ሶ እዚህ ጋር ምንድን ነው ያየነው? autoimmune neutrophils. Oh, damn. ወደኋላ የምንመለስ እሺ ሶ ክሮኒክ ሊምፎሳይቲክ ሉኪሚያ ኦኬ ይህን ሪቪው እናድርግና ከዛ እንመለሳለን ወደ መጠይቁ ይሆናል ወደ ጥያቄው እንመለሳለን ኦኬ ሲም ዛሬ ማውጣት አለብኝ right Jesus Christ okay so እያየን አይደለም don't have ችግር የለም ቆይ እየታየን ነው እንዴ so now plasma cells are essentially developed from B cells. Right, let's develop. Okay, where we are. Okay, let us see. Chronic ones. Oh, the chronic one. Okay, my notes, but I'm temporal. Okay, so I will try to catch up. Okay, this is for the okay. So the chronic one, ካየን በኋላ ቀጥታ ወደ oh Jesus Christ. Wait a minute. Smart cell ቆይ ምንድን ነው የሚያሳየው? Okay. ሶ ኖቴን አስተካክሎልኛል። ኦልራይት ሶ አኪዩት ሊኮማ ቅድም ክላሲፋይ ባደረግነው መሰረት ሶ ኦቨር ፕሪሊፌሬሽን ሬድ ብለድ ሴል ፖሊሳይቶሚያ ቬራ ክላሲፊኬሽን ማይሎድ ሴል ሲሆን ሁሉንም ነው የሚያጠቃልለው። and okay, now the acute leukemia, lymphoblastic leukemia, and so acute lymphoblastic leukemia, and what else? Acute lymphoblastic leukemia, acute myeloblastic leukemia. So we have now. So all right, this one አሁን የቅድም የተጠየቀው ጥያቄ መልሱ ምን ላይ ነው ያለው? This one is for leukemia overview fundamental classification. We classify them here. Then the acute lymphoblastic leukemia is the acute one. All right. AL is malignancy lymphocyte, lymphoblast, which is immature lymphoblast. Kaza the clinical presentation, as you can see, most often younger generation line yellow. Okay, can you see? All right. All right, Ski, let me see. I type your matter. Wait a minute. እየታያችሁ አይመስለኝም። All right. So this page is lymphoblastic. Okay, so acute leukemia. So this is acute leukemia. So let's go back to the screenshot. I hope በደንብ ይሄ እንትኑ ይሻላል አይደል? Then we have Hodgkin ምናምን እንመለሳለን። AML. Okay, acute lymphoblastic leukemia. I hope. Okay, so acute lymphoblastic leukemia. The clinical feature systemic symptoms አሉት። አንደኛው fever and also bone pain. So fever often due to cytokine release or secondary infraction ምክንያት ይሆናል. And most common cancer in children. And the fever is often due to cytokine release or secondary infection. And also it could be presented by expansion of bone marrow due to blast overcrowding. So there will be bone pain, and the physical findings are lymphadenopathy. የቅድም ጥያቄ we don't have lymphadenopathy. All right, እዚህ ጋር ምንድን ነው ያለን? No physical medical history, and all right, no. So all right, lymphadenopathy የለም. All right, but here we have swollen lymph nodes and splenomegaly, hepatomegaly, enlargement of the spleen and also liver due to infiltration by malignant cell. All right, so and the meningeal spread, CNS involvement, so blast can cross the blood-brain barrier. So meningeal, so the blast can cross the blood-brain barrier, and symptoms like headache, vomiting, and also nerve paralysis are common. So here we have the common settings is አራት ዓመት አቅራቢያ የሚሆን ልጅ ይመጣል with fever, bone pain, and the physical findings. He have swollen nodes and splenomegaly and hepatomegaly, and also meningeal spread, like it can manifest as headache, vomiting, and nerve paralysis. And this is the clinical presentation in the epidemiology. What about, let's talk about the bone marrow depression or cytopenias. So, because the marrow is packed with blasts and normal hematopoiesis fails, and that will lead to anemia because you see the blasts are packed in bone marrow and so kind of decrease, all right? Hematopoiesis will kind of decrease or even fail, and that will lead into anemia. Anemia is low red blood cell, and this thrombocytopenia, which is also low platelets, and neutrophil, neutropenia, and low healthy white blood cell leads to frequent infections. And the laboratory findings and markers are so the laboratory findings and markers are all right. So how do we know whether this is acute leukemia or others? So we have to see it on the lab. So in the lab, the preferred blood smear, so presence of lymphoblasts first, of course. So blast must be there, and this can look very similar to myeloblasts. Therefore, immunophenotyping is required. And so, one of the methods is TDT, terminal deoxynucleotide transferase, and this is specialized DNA polymerase. It is an enzyme and found in the nucleus, and it is expressed only in pre and the soil. So this is a marker, Maleno. So it's a marker because it's only expressed pre-B and also pre-T lymphoblasts. And the diagnosis rule is so TD plus TD positive means they're not myeloblasts, Maleno. So the myeloblasts. So how do we differentiate the myeloblasts with lymphoblasts? All right, both of them are white blood cells. So to differentiate the lymphoblasts with myeloblasts, so as you know, the lymphoblasts are the T and B cells. They are the lymphocytes. They are the last stage. So how do we differentiate them? We differentiate them by studying the TDT or terminal deoxynucleotide transferase, and that will help us. So the diagnosis rule is TDT means they're not myeloblast mature cells, and myeloblasts are TD negative. All right, CD means they're not myeloblasts. So the lineage specific markers. Okay, so now we know, but what? I didn't get it. So if you didn't get it, I will explain it very briefly and bear with me. So the lineage specific markers. So the markers are for B cells. All right, the marker is CD10 and also CLL. And we have CD19, CD20, CD21, CD22, and CD23. So note that CD10, CD19, and CD20 are critical for uh, diagnosis. So B cell line እነዚህ CDC ይታያሉ. So the pre cells, CD10 is very important. So now for the pre and the D, we see እነዚህን. So but for the C cell markers, here we go, CD2 up to CD8, and mark here, we don't have CD6 or CD9, okay? ከሲዲ ሁለት እስከ CD10 ያለው. So except that CD6 and CD9, we don't see them over here. So you see T cell marker is your this. The T cells are the lower one. For the B cells, they are the upper. Okay, በጣም ከፍ የሚሉት ቁጥሮች ናቸው. So 10, 19 up to 23. Okay, so the genetic subtype and prognosis. So, but these markers may not be that much attractive to us. But here we have the genetic subtype and prognosis. One of it is a Philadelphia chromosome, so the translocation of a gene from 9 to 22, so found in 22% of adult AL cases, and it is your poor prognosis, ብዙም እንትን አይልም, but found only on the 2.3% of the children. So yeah, and the translocation of 12 to 21 translocation. Here we have also fusion of these genes. የቅድሙ BCL ምናምን gene ነው for the for the what was it for? All right, so for Philadelphia chromosome, all right, like, and also we may also see Down syndrome link. So children with Down syndrome have increased risk of ALL. So, and approximately 1 in 3 cases of leukemia have Down syndrome. So Down syndrome ካላቸው maybe the መጋለጥ እድላቸው ከፍ ያለ ነው ማለት ነው። ከዚህ ጋር በመገናኘት አንድ ላይ so the demographics are T cells, LA specifics. Most often እዚህ ጋር ቅድም ያወራን they are mostly B related ናቸው. So when we talk into B specifics, T cell specifics, so more common in adolescents males. So mostly B specific ናቸው out of 20% 80% ቅድም አይተናል I hope. And B specific cells, B specifics are like so mostly adult nacho, so often present as mediastinal mass. So mediastinal mass, this ችግር ይፈጥራል mediastinal mass on the mediastinal part of the thymic mass, and this complication will superior vein cava syndrome and the compression of SVC leading to facial swelling and venous distension and tracheal obstruction as well, and leading to difficulty breathe and dyspnea, your difficulty to breathe, and pleural infusion and fluid build around also the lung. And the treatments are like chemotherapy is good, but it may sterile the male, like for children, and a place where reach and they must be treated specific to prevent relapse. Right, so in the what the hell? So spinal CNS, spinal cord and brain. So now let's go to acute myelogenous leukemia. All right, and I hope the chronic one ያገኘን ይመስለኛል. Well, let's move to the second question. Okay, before እናጠናለን በኋላ ደግሞ. So here we go. Acute myeloid leukemia. Okay, ሳናጠናው እንመለሳለን. So a 55-year-old male present with fever, gingival bleeding, and fatigue for 2 weeks. And he appears pale, all right, pale, hold on, and has a petechia on his lower extremities, and laboratory studies shows, all right, this is በጣም extreme ነው. Hemoglobin is severe, platelets is also በጣም ትንሽ ነው. Petechia is one of the markers, and preferably smear 40% blast, occasionally with our rods. This is the really the marker of this. Our rods is like the marker. No? So, all right. So, which one of the following is most specific finding for the diagnosis of acute myeloid leukemia? So, we know chromosome. This is not acute myeloid leukemia, but acute lymphoid leukemia. Acute lymphoid leukemia ላይ ነው ያየነው ቅድም. So our roles is very very important. በቃ ይሄ ነው, this is the marker. ይሄን ካገኛችሁ በቃ አያስፈልጋችሁም. The terminal, this is also ሁለቱ, these are for acute lymphoid and smudge cell. Okay, smudge cell, maybe smudge cell, but smudge cell is for the chronic one. So our road knows. Okay, this is our road is so አሳያችኋለሁ our road. So in the on the side ላይ ያሳያል። Alright. Okay. You see our road? This is our road. ከዚህ ጋር ያለችው ነጠብጣብ ታያችኋለች? This is our road, okay? These are like ምንድን ናቸው እነዚህ? These are red blood cells. What about this? አሁን የምናወራው ስለምንድን ነው? ስለ ማይሎይድ ነው። ስለ ማይሎይድ ስለሆነ ኦልራይት whatever. This ገና ያልተሰራ ያላለቀ እንትን ነው። ስለ ማይሎይድ ፕሮጀኔተር ነው እያወራን፣ ስለ ሊምፎይድ ፕሮጀኔተር አይደለም። ማይሎይድ ከሆነ this is not this is blast cell but blast ነው ገና። I hope it is blast ግን it's not የሊምፎሳይት አይደለም። ሊምፎሳይት blast አይደለም። this myeloblast ነው. So it could be, you see, it could be eosinophil or ምናምን ግን we will check it out. But this is myeloblast ገና እንትን ያላለም። So this is our road. So our road accumulate ካደረገ it may lead to DIC, sepsis ምናምን. And there is MPO. Alright, we will talk about this later. Anyways, all right, let's go back to our road. So our road is pathogenomic for AML, and it's acute, and they are composed of primary granules and are seen needle-like inclusion in myeloblast. Okay, it's a myeloblast, and these ones are like CD, T marker now, and this is also the marker positive ALL lymphocyte. The AML Philadelphia is seen in CML and some PLL. Okay, PLL ላይ ይታያል፣ CML ላይ ይታያል። Small cell is characteristics of CLL በኋላ ላይ የምናየው። So now let's read about AML ማለት ነው። Here we go. AML, where are we? AML, alright. So AML is malignancy of myeloblast originating from myeloid progenitor cells. Alright, cool. And the epidemiology as the primary demographics, it's unlike acute. This acute myeloid lymphoid, this one is for old males and median ages around 65 to 70, and the male female ratio is 5 to 3. So presentation line most commonly male, it is adult ምናምን ከሆነ mostly 5 to ratio. Sorry, ratio. And let's see about splenomegaly ካላቸው. So the symptoms and myelosuppression. Okay, of course, anemia is one of the feature. Neutropenia, recurrent for severe, and bleeding gums. Okay, this is bleeding gums particularly. Enlargement lymph node and spleen are less common, so this is typical. Okay, this is one of typical feature. Cool. So arongari, green flag. This is green flag. And the pathologic hallmark. All right, this is the pathologic hallmark. This is myeloperoxidase. So myeloperoxidase. Blasts are M positive. So this is hallmark. So ቅድም ላይ ያየነው አለ አይደለም LTD positive. So for this case, and also our so crystallize in photo እናድርግና እናንሳት ሲያምሰን ደግ እናድርጋት ማለት ነው። This is our board. This is our board. Alright. This is our road, and if our road is split into the blood, they trigger DIC, and they are pathognomonic. If you see our road, it's definitely በቃ የኖር our road ካያችሁ is in the cytoplasm of the cell. Okay, cytoplasm ላይ ይህን ካገኛችሁ በቃ this is the cytoplasm ላይ our road ካገኛችሁ በቃ ሌላ ምንም መጠየቅ አያስፈልግም። it's AML. So acute promyelocytic leukemia, subchemistry. So there we have translocation of T50 and T70, and also fuses the PML gene, so chromosome 50, with rare gene retinic acid receptor alpha on 17. So this creates abnormal receptor that traps cells in this stage. So this stage ላይ ሆነው እንትን እንዳይሉ ያደርጋቸዋል. So this is from myelotic stage. Okay, myeloblast stage ላይ let's see like ላሳያችሁ. Myeloblast stage ላይ got this like cytovera, mamma luna. Nana. Alright, let's go. Prolocyte is a large immature white blood cell precursor in the bone marrow line. ይሄ ነው ማለት ነው። So አሁን እዚህ ጋር እንደምታዩት this is immature granulocyte። አሁን እዚህ ጋር these are the like neutrophils አካሄዱን ብትመለከቱ these are like ይኸውና here we have myeloblast. This is the myeloblast progenitor. ይሄ ደግሞ የኒውትሮፊል ነው። ኦኬ በአንድ ኒውትሮፊሊያ እዚህ ጋር ስፔሲፋይ የሆነ ማይሎብላስት እዚህ ጋር ያችሁ ማይሎብላስት ስላርጅ ነው። ደን ፕሮሞ ማይሎሳይት ኤንድ ማይሎሳይት አያችሁ እየቀነሰ ነው የሚሄደው ለኒውክለስ እየቀነሰ ነው የሚሄደው ለኒውክለስ ደን ዩሲ እዚህ ጋር ሜታማይሎሳይት ብራንች ሶ ቅድሙ ፕሮብለም ኢዝ ዲስ 17 translocation is the here immature line ላይ ያለ ነው ማለት ነው. So as you can see fuse the gene with this gene retinoic acid receptor alpha on the chromosome 50 and this create abnormal receptor that trap the cell in this stage. Okay, stage ላይ fuse አድርጎ የሚይዘው ነው. So this fusion of PML from 50 to 70 this creates abnormal receptor that traps the on that stage manner. So okay, further development I know. So the one of the treatment is this all trans retinoic acid. It's kind of a form of vitamin D and it forces the abnormal cell to mature into functional neutrophil. ወደ functional neutrophil እንዲሄድ ያደርገዋል ማለት ነው. So emergency APL is medical emergency because the promyelocytes contain many rods MPO and making the IC very common initial presentations. Alright, so acute promyelocytic leukemia is part of myelogenous leukemia. So the other is myelodysplastic syndrome, and this MDS is often called pre-leukemic stage. All right, this is the pre-leukemic stage. Why? Abnormal myeloprogenitor cells that leads to ineffective hematopoiesis. So ineffective hematopoiesis, and then so the diagnosis is okay, show dysplasia or abnormal looking cell, and the blast count is less than 20%. So if it is exceed 20%, it's an official congratulations, we have AML. So it's pre-stage no, and the blast count is also this and shows abnormal leukemia. So in lab ላይ ምናምን የሚታይ ከሆነ we will see it here. ይሄ ለጊዜው ይቆየን. So the myeloblast one. Alright, እስኪ ኮፒ ፔስት ላድርገው እዚሁ. Alrighty. Alright, what is this? This is so promo. What the hell? Chromolase. Actually, neutrophil so yeah, neutrophil lineage. And so one of this is how differentiates from AML. It's less than cone. All the clinical feature, but this is less than cone. So the risk factors, prior radiation, ምናልባት prior radiation ከነበረ this is one of okay risk factors are ወደዚህ እንዲመጣ የሚያነሳሱ one of them is the prior radiation therapy and the previous usually occur years of exposure ማለት ነው. So the study checks here we have አንደኛ future, our future is here we go CLL and AML. So the typical age is for children are at years, for adults 65 plus years, and the key markers are here and MEPO, and the hallmarks are mediastinal mast cell and our road, and the genetic good. Okay, this is good prognosis, and this one is bad prognosis or Philadelphia chromosome. Special risk Down syndrome ካለ or ደግሞ this power, so the checkers. This is checker notion, reminder for notion, key notion, so lymphoid cells, roles. So now let's add it in the checker. Checker, we know this, and of course this as well. አሁን ስለ እንትን አጨረስን ማለት ነው። Sanctuary sites. Okay, MDBS become AML once the blast is 20% smaller. So this is our notes, my notes. So I hope now let's go and do more questions. All right. እሺ አሁን AMLን አንብበናል. So occasionally, right? Now let's go to chronic myeloid leukemia. Okay, so a 45-year-old man is found to have this. Okay, በጣም ብዙ ነው 120 white blood cell. The normal is ከ6 እስከ 10 ነው. On routine examination, he reports mild fatigue, but otherwise feels well. And the peripheral smith shows neutrophils at all stages of maturation, including few myoblasts. Okay, less than 5%. And his platelet count is slightly elevated, so his platelet count is kind of higher, and the spleen is palpable and 5 meters below left costal margin. And which of the following is most likely diagnosis and expected cytogenic abnormality? So now all kind of እዚህ ጋር ካገኘሁት ውስጥ so CML with T ቅድም Philadelphia chromosome can be found for AML and also not AML, ALL and CML. So examination is preferred smear neutrophils at all stage. Okay, one of the so maybe this can be one of his marker. All of them could be found in the preferable smear. Immature. Oh, is it immature? It is mature, right? Oh, if it is mature, it's normal. It has to be immature. Oh, is it? Prefers me all stage of maturation. So if all stage of maturation, we can. And so I have no clue, but I do have notes. I do have notes. Let's refer the notes. All right. All right. Jesus Christ is good. All right. It's not what you have, it is how you choose. What? Where are we? What happened to you, America? Okay, English. Okay, now let's go to CML. CML, CML. So, chronic leukemia comprehensive study guide. Okay, now let's go. Covers malignant proliferation of microfibrillation. Now, let's move on. So, as you can see, lineage myeloid involved granulocyte. The clinical feature is acute or clinical course rapid or chronic. This is slow onset of symptoms, and the acute one is rapid onset of symptoms. Okay, rapid onset of symptoms are asymptotic. This one is, as you can tell, it is immature cell, and this is characterized by more mature malignancy rather than blast. Leukemia, it's all type of mature neutrophils are found in the peripheral blood smear. So, alright, CML is malignant disorder, myeloid progenitor cell, of course, categorized by myeloproliferative disorder. Cool. Now the pathophysiology, there is dysregulated production of granulocytes. Alright, it could be neutrophils or basophils, secondary neutrophils, huh? Or basophils. Alright, so this is dysregulated production. Okay, uh, chronic CML. Now, clinical phases. So, clinical, the chronic phase usually lasts for like 5 years. Often describe routine blood test amount, so symptoms like these guys. Of course, megaly አለ, no hepatomegaly or lymphedome, subreferous mucus leukocytes above kind of this እዚህ አካባቢ ካሳየን the differential is like እነዚህ or እነዚህ ራሱ ይታያሉ and even band cell ራሱ ይታያል. All notable basophils are kind of rare ናቸው, usually fewer than 2%. So then it gets into the accelerated phase and usually lasts for a month and characterized by treatment failure and the rise of RBC count despite therapy and the blast cell crisis. Then this accelerated case, then the disease transforms into acute leukemia and greater than percent of peripheral bone marrow ላይ ፕላስ ቅድም ላይ 2 ነበረ የዛን 2% now plus and then acute leukemia then usually transform into AML myeloblast and but can transform into ALL lymphoblast in 25% of the cases. Right, so usually myeloblast one is here, but it also can transform. This is critical. Like you can ask, how, what the hell? Because AML, okay, AML, CML, okay, AML, but how ALL? That's the question. But it can also transform into that case. Yeah, because after all, both of them are developing bone marrow, so this will indeed create a blast crisis because somehow they are connected. I don't know some part. So, but we will figure it out ይሄን ነገር እንፈልገዋለን በኋላ ጥሩ መጽሐፍ ላይ so CML and versus leukemoid reaction left shift. So leukemoid reaction is normal high and normal and high WBC response to infection. It must be distinguished from CML. And white blood cell counts is like okay, we have here them very high. And now let's distinguish. So because CML and infection like unit are lateral, because when you have infection, one of the marker is you white blood cell count HMR because when you have infection, neutrophil count HMR because neutrophil is the fighter cells and also macrophage and metal. Of course, macrophage are not myeloid myeloid pass, but the neutrophils also in the myeloid pass. So it's on the myeloid pass. Macrophage is also myeloid pass. But now, how do you differentiate them? Okay, well, right. As you can see, okay, highly unusual. This is normally high. So the normal range is considered a high association per microliter. But in infectious case ትንሽ ነው የሚጨምረው 7000 ምናምን ከጨመረ ምናምን but in chronic myeloid leukemia is out of range like 100% ነው የሚጨምረው 100% ነው የሚጨምረው ከ10 እስከ 100,000 ድረስ ምናምን ሊሆን ይችላል. So one of the marker is this. The second one is lap and lap score. So high enzyme lap is like leukocyte alkaline phosphatase now okay እንትን የያዛችሁ ኢንዛይም እየያዛችሁልኝ ኦኬ እዚህ ጋር ኢንዛይም እየያዝሽ እዚህ ጋር ገለቴ ቡርቃ ኢንዛይም እያልሽ እዚህ ጋር ዝም ብለሽ እንትን አትበይ። ኢንዛይም መያዝ አለብሽ። እዚህ ጋር ኤምፒኦ ቅድም ቲዲቲ ፕላስ ኦኬ ቲዲቲ አይተናል ነው ላፕ ኦኬ እቺኛዋ ለምንድን ነው ያልናት? ገለቴ መልሽ። እቺ የምንድን ናት? እቺስ ይሄኛው የምንድን ነው? አኪዩት leukemia. This is myeloid. ያ ደግሞ along with እዚህ ጋር ምን እናያለን? along with our road አላለም? our road እዚህ ጋር ፊላዴልፊያ ክሮሞዞም marker on it. So this, but now here we have CML is a marker. Common infection መሆኑና CML መሆኑን የምንለይበት ነው ማለት ነው። But how የሚለውን ደግሞ ኖቱ ላይ እንመልከት። So how? This is an enzyme found in the secondary granulocyte of normal neutrophils. Because CML neutrophils are malignant and dysfunctional, they lack this enzyme. So this enzyme is found on the secondary granules of the normal neutrophils. So in the normal neutrophils, we can find this in their cytoplasm, in the granules, okay? But because CML neutrophils are malignant and dysfunctional, they lack this enzyme. So, okay, you have lab positive means, okay, አላችሁ ማለት which is አላችሁ ማለት it is not እንትን ማለት ነው። So you have low ይኖርሃል ማለት ነው። So በሌሎቹ ላይ ግን it is አለህ ማለት ነው አይደለም። እዚህ ጋር ግን if you lack you have okay CML ማለት ነው እዚህኛው ላይ if you lack this guy this our guy ይሄው CML አለ ማለት ነው። alrighty what else? Philadelphia chromosome absence infection ላይ so infection case ላይ chromosome ጉንፋን ስለያዛችሁ ምናምን እዚህ ጋር absent ነው ኦኬ ምንም ለውጥ የለውም but present in high and this present ያደርጋል so one of crazy ነገር ነው this ይጨምራል and typically present basophilia typically present ያደርጋል so we will see this thing እንዴት እንደዚህ እንደሆነ we will see. All right, now let's go እቺኛን ነው መረዳት ያለብን አይደል? And also so genetic hallmarks is this Philadelphia chromosome. So BCR is very essential gene ሊትራሊ በጣም ፖስት እንትን ነው አፖፕቶቲክ እንዳይሆኑ ነው የሚያደርጉ ሴሉ ስሊቭስ ሎንገር ቬሪ ሎንገር ቢሲአር ኢዝ ቬሪ ቬሪ ፊውዝስ ዊዝ ኦኬ ቢሲአር ፋውንስ ኦን ክሮሞዞም 22 ላይ የሚገኝ ጂን ነው and fuses with ABL gene ABL gene on the 9 ማለት ነው so this create this fusion protein and አጠገብ ላጠገብ የሚቀመጡት ነው let's see ላምጣና let's see the okay so ቅድም ያየናቸውን ደግሞ እንደዚህም እናጥፋቸውና so this creates this fusion of protein and which act as constitutively active tyrosine kinase so active tyrosine kinase active ያደርገዋል so በቃ ማይቻል ነው የሚሆነው so ይህን activate ያደርገዋል so the cell will proliferate በቃ ዝም ብሎ ይኖራል ግን አይሞትም there is no control ማለት ነው so this protein signal the cell to stay alive much longer than normal and avoiding apoptosis and accumulate in the blood plasm in the bloodstream ማለት ነው so okay this is the science so እዚህ ጋር ኮፒ አድርገን ሴቭ እናድርጋት Alright, so we have normal chromosome 9 and chromosome 22 and ABL1 gene, chromosome break and change chromosome 22 Philadelphia, this PCR ABL fusion in Orama. So the chromosome ABL AB ነው ከ9 ጀምሯል so AB አቤል አለ ዘንድ 9 ነው so PCR 22 አቤል በ9 ዓመቱ በ22 ዓመቱ B treatment is in እንትን ማድረግ ነው so this inhibits enzyme inhibit ማድረግ ነው so like there are drugs ይህን የሚሰሩ these are name but ሁሌ መውሰድ አለብህ ይሄ ነገር ዝም ብሎ የሚቆም አይደለም so ሁሌ መውሰድ አለብህ ይሄን ነገር to block ማለት daily ምናምን so the longer term control of chronic not always curative so once በጣም ኃይል ከሆነ በኋላ what we do is bone marrow transplantation ያስፈልጋል ማለት so they take bone marrow transplantation and often after this failure ማለት so this long term so yeah and let's go to into right so this part so chronic lymphocytic leukemia all right this is chronic leukemia and now the second is lymphocytic leukemia. So lymphocytes, whenever we say lymphocyte or anything, so lymphocytes column, you have to think of B or T cells. So CLL is naive lymphocyte, newly produced B cells that haven't made an antigen yet. All right. And antigen okay so lymph immunophenotype is this for B cell express this CD20 okay they have marker as well the same as እንደዛው ግን the CD20 number now CD10 number now CD20 but also they have CD19 up to 23 all right so the confused marker the B cells also these B cells co-express CD5 as well. Okay, CD5 as well. Okay, BCL CD5. No, we don't have CD5 for the acute part, but now we have BCL. And then CD20 and explanation. This is normal T cell marker ቅድም ላይ ቅድም ካስታወስኳችሁ ከ3 ከ2 ጀምሮ እስከ 8 አይደለም exception of 6 this is of course it is the marker of T but finding CD20 on B cell is highly characteristics of CLL and this makes the cell look confused between B cell and T cell identity. So identity crisis ውስጥ የገባ ሴል ነው ያለው ማለት ነው። ጤነኛ አይደለም። አይደንቲቲ ክራይሲስ ውስጥ ገብቷል። ችግር አለበት እንፈታው ይገባል። ዩኒቨርሲቲዝ ማለት Alrighty. So now the clinical features, any kind of question. The demographics is like median age, 60 year old, 60 ዓመት የሞላው ሰው ነው and presentation often asymptomatic and found through CBC ላይ ነው የሚገኘው so ብዙም ሲምፕተም አያሳይም so ካገኛችሁት ሲቢሲ ሲመረመር ለሌላ ኬዝ መጥቶ ምናምን 60 ዓመቱ ነበረ ዞን ለሌላ ምርመራ መጥቶ ከዛ ሲቢሲ ላይ ሲታይ ጫን ያለው ምን እየሰራ ነበር እስካሁን ይባላል ማለት ነው። This is commonly asymptomatic now. So 5 to 10% of patients experience fever, night sweat because of extra metabolism and weight loss ይኖራል። Then the physical signs are lymphadenopathy. Okay, lymphadenopathy. All right, lymphadenopathy ምን ላይ አይተናል? ALL ላይ አይተናል። አሁንም ይገኛል ማለት ነው። splenomegaly and hepatomegaly. Okay, this is ከአኪዩት ጋር ይመሳሰላል አይደለም? Okay, ከአኪዩት ጋር ተመሳሳይ ናቸው። ከአኪዩት ጋር then the peripheral is smudge cell. Smudge cell አሁን አሳይሻለሁ ማለት smudge cell is search in Google ከዛ ቅድም አግኝተናል። ኦኬ let's close it. አውሮድን አግኝተናል ቅድም yes let's close it. ይሄን አግኝተናል። ኦኬ let's alright አልመጣም እስካሁን alrighty alrighty smudge cell የተጨፈለቀ አይነት smudge cell ማለት smudged alrighty So I'm planning to create an algorithm for every disease and put it on web app. So we will see ምን አይነት እንደምናደርገው. But I will create an algorithm so that okay, a checker, so a gamer. So you can, it's a game, okay? Kind of a game. Then okay, we will present to you symptoms. Okay, cool, kind of stuff. Okay, ጠጠር ሜድ ጠጠር ሜድ Bible Square Where is As you can see, this is smudge cell. All right, Bobby. This is my smudge cell, okay? This is smudge cell. And as you can see, የተደፈተተች ናት። Okay, smudge cell. Now we are talking about CLL, lymphocyte. Okay, these are lymphocytes, okay, not neutrophils. They are lymphocytes, but የተደፈተቱ ናቸው። ድፍጥጥ ያሉ ናቸው። ህይወታቸውን አጥተዋል። መስዋዕት ሆነዋል። ለሀገራቸው ነፃነት ተዋድቀዋል። ስመጅድ ናቸው። ስሞክድ ሆነዋል። They are smudged cell. All right. Where are we? They are smoked. ገጣሚ ቢኖር ነው። They are smoked. Okay, smudged cells. They got smoked. Let's finish. All right, so the complications are hypogammaglobulinemia, and this is a decrease in IgG, IgA, and IgM because of the malignant B cells don't produce functional antibody. Yeah, it will decrease. ቅድም ላይ የአይደንቲቲ ክራይሲስ ውስጥ የገባችው ሰው አለች አይደል? በቃ አታመርትም እንጂ ስራ የለም። ኢትስ ናይቭ ቢሴል ኢትስ ናይቭ ቢሴል በቃ ሞኛ ሞኝ የሆነ ናይቭ ናይቪቲ this leads to increased susceptibility to bacterial infection. Yeah, because most common cause is ሊያስከትል ይችላል and autoantibodies produced by non-neoplastic normal B cells in response to the cancer and can cause autoimmune hemolytic anemia. Autoimmune and produced by neoplastic or normal B cells in response to cancer and yeah, auto antibody direction and can cause to autoimmune hemolytic anemia ሊያስከትል ይችላል and I didn't see this ከየት እንደመጣ because yo this is facts after facts after facts after facts there is no reasoning that is bullshit man we got to read a good book okay this is like facts after facts after facts after facts after facts after so this means immune cell accidentally makes attack protein or antibody that stick to the body own red blood cell and cause them to destroy and leading to anemia. All right, cool. Thank you, brother. Thank you, brother. All right. Okay, thank you, brother. All right. Thank you for your explanation. Okay, a bit. Thank you. Thank you. All right. So, rich transformation, a cell transformed into diffuse large B cell lymphoma. And a sign a patient with non-CLL suddenly develops a rapidly growing single lymph node ሊያጋጥም ይችላል and small lymphocytic lymphoma. This is also another case and whoa እየፈተነች ነው and we have small lymphocytic lymphoma and is essentially the same disease as CLL but the only difference is where malignant cells are located and concentration in the blood. And CLL definitions are like here. This is the difference. Focus greater than 5000 per unit per this micro unit and is focused in the lymphoid and so this is it's kind of similar as cell but small lymphocytic lymphoma and this can cause hemolytic anemia so the hemolytic differentials risks are like so these are CML CLL ሊሆን ይችላል so writer transformation the cell transform into diffuse large B-cell lymphoma a patient with known sudden develop rapidly growing single lymph node ሊመራ ይችላል ማለት ነው so there are hairy cells I have to, you have to see hairy cells ቃላ ጎፈሬ ምናምን ናቸው ፀጉራቸው እንደዚህ እያወጡ እየነሰነሱ ምናምን ነው የሚንቀሳቀሱት they are kind of fashion ተከታይ ናቸው so as you can see this is lymphocytes so the lymphocytes have this all right these guys are the kind of lymphocytes all right so this is hairy lymph oh I should have okay so this is hairy lymphocytes rare chronic as you can see right this is hairy cell what is that hair made of okay this is hairy ነገር ናቸው so ፀጉር ያላቸው ይመስላል ያያችሁት right እዚህ ጋር this እነዚህ as you can see እዚህ ጋር ያሉት this hairy things እነዚህ ያያችሁት this hairy ፀጉር ያለው ነገር ይመስላል አይደል what is this hairy thing what is it what is it what is it all right let's go and the marker express this, guys. Okay, note this. Usually negative for CD1 markers. The morphology and CD and also CD103. Hairy are lymphocytes with fine, hairy like cytoplasmic projections visible on the peripheral smear. What about their massive? Okay, massive splenomegaly. Splenomegaly become engorged with hairy cell and cause white pulp to atrophy or obliterated. Dry trap on bone marrow biopsy. When attempting to draw marrow, nothing comes out. This is because hairy cells induce marrow fibrosis, and trapping the cell in the bone marrow. And trap positive, the cells contain an enzyme called this, and hairy cells show strong positive for this staining. And the clinical presentation, median age. Okay, then symptoms with abnormal pain, abdominal pain due to massive splenomegaly and weakness and cytopenias. Bone marrow suppression leads to anemia and decreased platelets. So, okay, anemia and decreased platelets. And the treatment, cladribine, the preferred initial therapy, and it is purine analog. Okay, this purine analog, adenosine ይመስላል this drug, except that CL አለው ማለት ነው. So excellent clinical response and often long-term remission ማለት ነው. So let's move to the next question. Now we are here. Where are we? Okay, CML now. We read. So yeah, this is the answer ማለት ነው. So CML usually present with markedly elevated days, በጣም ከፍ ይላል, and with full granulocytic maturation, and is creating BCR fusion, ቅድም እንዳየነው, and JAK2 is like ለሌሎቹ ይሆናል ማለት ነው. is seen in myeloproliferative lymphoplasm, and this is eJAK2. እነዚህ are JAK2. Okay, myelocytemia vera. Okay, acute lymphoblastic leukemia. So acute lymphoblastic leukemia አይተነዋል ቅድም አይደለም? Let's do a question. So body bone marrow, pallor for 3 week on exam. Okay, 4-year-old, cool. አላቸው hematosplenomegaly and cervical lymphadenopathy አለው. And this is in good range. Hemoglobin is severe, is anemic ሊሆን ይችላል. Platelet counts, it's also በጣም ትንሽ ነው. Okay, this shows no የላቸውም, no positivity ቅድም ባየነው መሰረት, as you can see እዚህ ጋር. Okay, AML no ብለናል, ያው የለውም, ኔጌቲቭ ነው. All right, this is all right. No positive የለውም. So which of the following is most likely diagnosis? Okay, what is the diagnosis አላችሁ? What's the most likely diagnosis አለኝ? Which of the following is most likely diagnosis? ምንድን ነው? what the fuck is going on? ይኸው በቃ ዲ አይደለም እንዴ? ከፍ ያሉት ከሆነ ቢ ሴል ነው። በቃ ቢ ሴል አክቲቭ ሊምፎብላስቲክ what the hell? ብሩክታዊት እባክህ ሌላ ናት። ኦኬ ኒትሮፒኒያ ድራግ ኢንዱስ ሶ ኒትሮፒል ስማይሎብላስት ነው። ሶ ሃይፐርቴንሽን አርቴሪያል እነዚህ ያላቸው on this drug for newly diagnosed grave disease 4 weeks later she present with fever, sore throat and severe malaria and lab study shows እዚህ ጋር ኒትሮፔሊያ neutrophil count is like ይሄ ነው። በጣም ትንሽ ነው። hemoglobin and platelets are also normal. Okay, which one of the following is mechanism of finding this? So folate deficiency. Alright, this is በጣም white blood cell በጣም ዝቅ ያለ ነው። Okay, so bone marrow fibrosis, splenic sequestration, ሜቢ ስኳስትሬሽን ሊሆን ይችላል። ግን የተመረመረው ምን ነው? ብለድ ስሚር ነው እንዴ? What is the blood smear? So, folate deficiency mechanism finding immune mediated agranulocytosis, bone marrow fibrosis. Maybe bone marrow fibrolysis ሆኖበት ይሆናል ቢካዝ በጣም ይቀንሳል አይደለም ቅድም ባየነው ሰው ኦኬ ሲ ነው immune mediated agranulocytosis. Okay, why? And our classical cause of drug induced agranulocytosis. And okay, drug ሰጥቶኝ ነበር አይደል እዚህ ጋር so immune mediated. Okay, cool. So mechanism, immune mediated destruction, hepatin induced antibody or direct toxicity to myeloid precursors, presentation, sudden fever, pharyngitis, and severe neutropenia. All right, ምግብ ልብላ በፈጣሪ ስም here. እሺ አረላሽ ምግብ በልቼ ልምጣና ሌሊቱን ሙሉ ሌሊት ሳይሆን ምግብ ልብላ በዛው የሆነ ነገር ይዤ ልምጣ ከዛ እንትን እንላለን። አረላሽ አልቻልኩም በፈጣሪ ስም። ሌትስ ኤንድ አንድ ሰዓት ይሆናል። ኦኬ ሶ ሌትስ ኤንድ አሁን እዚህ ጋር ከዛ እንመለሳለን በኋላ ሰው የጀመርነውን ጥያቄዎች እንጨርሳቸዋለን ማለት ሶ ቱዴይ ዛሬ ቅዳሜ ነው አይደለም ዊ ዊል ወርክ ኦን ዋት ብለድ ሴልስ ሙሉ ማለት ነው ሶ ከዛ ዊ ዊል ዱ ደግሞ ፋርማኮሎጂ questions እንሰራለን in reading I'll share my notes እና እንትን እንላለን for now today white blood cells ላይ በደንብ እናተኩራለን and pharma and also the platelets one we will see it later ሌላ ጊዜ or ነገ ምናምን ግን ለዛሬ እዚህ ይሆናል ባይዘዌያችን this በዓል ላይ ነው ዛሬ so ዛሬ kind of ስቅለት ትላንት ነበረ so today ነገ ደግሞ ትንሣኤ ነው so yeah ለመላው የኢትዮጵያ ክርስቲያኖች ሁሉ እንኳን አደረሳችሁ የሚያዩ እንኳን ባይኖር የሆነ ቀን ማየታችሁ አይቀርም this is crazy